Hanks, known to friends and family as Tommy, is a 5-year-old boy that was adopted slightly over a year ago. Tommy's closed adoption leaves his parents without knowledge of his genetic background. Tommy, like many other 5-year-olds, is getting ready to start team sports. His choice for the fall was soccer. While practicing with his team for the big game the following week, Tommy got overexcited and fell in an attempt to score a goal. His parents took him home and iced his knee, but the swelling only got worse. His parents gave it some time, but were growing concerned. Shouldn't his swelling have gone down after a few hours? Tommy bruises easily, but his parents typically keep a watchful eye to avoid any unnecessary injuries, as many children his age are very clumsy. Tommy's parents have never had any serious medical problems and therefore attributed his easy bruising to him being delicate. Tommy's parents decide to take him to the pediatrician because his swelling and bruising has not gone down and Tommy has become very irritable and tired. The pediatrician examines Tom and has an idea of what might be going on, but is not quite sure because he is so much older than her typical patients with this condition. Before sharing her ideas with Tommy's parents, she asks them questions such as, does he bruise easily, and have you ever had trouble stopping any sort of bleeding? His parents answer that Tommy has never been through any particularly bad trauma that they would have noticed any severe bleeding, however, he does bruise easily. The pediatrician explains to his parents that because of his unknown genetic background, she believes it is likely that Tommy has an undiagnosed blood disorder. She refers them to a hematologist to run tests in order to diagnose this condition. In the meantime, she recommends two classic methods to see if the swelling will come down: giving Tommy ibuprofen and icing his knee a few times a day in order to reduce the swelling. In addition, because the pediatrician believes it to be blood-related, she has Tommy vaccinated against hepatitis A and B in the event that he needs something like a blood transfusion. This will make sure he does not catch any unnecessary diseases. The hematologist takes Tommy in for a variety of blood tests to see if his condition can be diagnosed. The hematologist runs 4 tests: CBC, PT, APTT, and clotting factor tests. The CBC, also known as complete blood count, checks for a few different things such as red and white blood cell count as well as platelet count. Tommy's CBC comes out fairly normal without any red flags. This includes the hematocrit test. The PT, also known as prothrombin time, measures how long it takes for blood to clot. Tommy's PT tests come back fairly normal. The APTT, also known as activated partial thromboplastin time, is also a test to measure the amount of time it takes for coagulation. It checks specifically for factors 8, 9, 11, and 12 in regards to clotting ability. Although PT and APTT check for similar things, APTT involves adding an activator to speed up clotting time. Tommy's APTT tests show that he has a longer clotting time than a normal person. Clotting factor tests are used to specifically diagnose bleeding disorders based on their blood's ability to coagulate. This test would definitely need to be ordered after Tommy's prolonged APTT results. The clotting factor tests check for severities of the blood disorder known as hemophilia by looking at the levels of factor 8 and factor 9 in the blood. With the results of his clotting factor tests coming back at roughly 23%, Tommy is diagnosed with mild hemophilia A, meaning he does not have enough of clotting factor 8. With hemophilia being a genetically inherited disease, the hematologist sends Tommy to a geneticist to have tests run to learn more about the genes that resulted in this disease. Hemophilia is a genetic clotting disorder of the blood which causes excessive bleeding. In Tommy's case of hemophilia A, there is a lack of clotting factor 8. Type A is more severe than type B, but only in about half of the cases. The gene for hemophilia is found on the X chromosome, making males more susceptible as females have 2 X chromosomes where one could cover for a faulty X. However, if a female is a carrier of the hemophilia-inflicted chromosome and has a male child, the male child has to either have hemophilia or not. There is no possibility of him being a carrier but not being affected. Hemophilia occurs in 1 in every 5,000 male children born. Meanwhile, there are approximately 20,000 people living in the United States with hemophilia. These people will live approximately 10 years less than a male without hemophilia, but if it is well managed, their life expectancy can be very close to those without hemophilia. Hemophilia was known as a royal disease as it was prominent in the ruling families of England, Russia, Spain, and Germany. This disease spread throughout these families because of its genetic component, but Queen Victoria was the origin as she carried the hemophilia gene. Her gene was caused by a spontaneous mutation, and it passed through the royal families as they did not marry outside of their social classes. Arguably the most well-known case of the royal hemophilia was that of Alexei of the House of Romanov, the son of Tsar Nicholas II. His parents sought the help of the famed faith healer Grigory Rasputin in order to cure Alexei's hemophilia. Tom's hematologist recommends that Tom takes regular infusions of DDAVP, also known as desmopressin. This stimulates an increase in clotting factor to stop bleeding. His parents can decide to use clotting factors from human blood or recombinant factors that are not from human blood to reduce risk of disease, although it is low either way. This will help Tommy maintain a normal life as he starts to get older and becomes more involved in activities that put him at risk for injury, as his blood will be able to clot better than it is able to. In addition, fibrin sealants and antifibrinolytics can be useful in clotting assistance. Fibrin sealants are applied directly to wounds as a form of quick first aid to aid clotting, and antifibrinolytics are medications that can be taken to ensure that clots are not broken down. In addition, the hematologist explains that Tommy has the option to be vaccinated against hepatitis A and B if they choose for him to use human blood clotting factors. Thankfully, he has already been vaccinated against these diseases at the recommendation of the pediatrician. Tommy's hematologist makes a later appointment with him to discuss final treatment after his meeting with the geneticist and genetic counselor. Tommy and his parents head to the geneticist in order to get a diagnostic genetic test. They meet with the geneticist, who takes a small sample of blood from Tommy, of course with an injection of DDAVP ready to stop the bleeding from the sample. This diagnostic genetic testing is used in order to detect a specific gene alteration that would cause a genetic disease. In Tommy's case, they will be using a direct DNA test. These tests will be able to look at his faulty chromosomes and officially diagnose his disease. His test takes several weeks to come back, so Tommy's family begin experimenting with treatments to see what works the best for him before going back to the hematologist later that month. When they finally receive the results of his genetic tests, it is confirmed that he does in fact have an affected X chromosome, therefore he has hemophilia. The geneticist then decides to send Tommy and his family to a genetic counselor with this final diagnosis so they can understand how their lives will be as Tommy gets older. Tommy and his parents meet with their genetic counselor. The genetic counselor educates the family on what to expect with Tommy growing up. Although he has mild hemophilia, all forms of hemophilia need to be taken seriously. The genetic counselor informs them that Tommy will have to be very careful in things like sports and recommends low-impact or safer sports like track or swimming. This will reduce the possibility of injury that could put someone like Tommy at a serious risk. The family is advised to avoid any unnecessary risks for bleeding, but not keeping Tommy out of normal childhood activities. In the future, if Tommy has children, his children could potentially be at risk for having hemophilia or being carriers. If Tommy has children with a woman who is not a carrier, any sons that they have will not have hemophilia, and any daughters will be carriers. If Tommy has children with a woman who is a carrier, their daughters have a 25% chance of having hemophilia or being a carrier, and any sons also have a 25% chance of having hemophilia. Although it is possible for hemophilia to disappear from a family tree, the genetic counselor lets the family know that it will likely be passed on to Tommy's children in the form of a carrier. With this knowledge, Tommy and his family head back to the hematologist to discuss final treatment options. The hematologist gives Tommy's family his final treatment recommendations. With the options of DDAVP infusions, fibrin sealants, and antifibrinolytics, Tommy's family and his hematologist have decided to treat him using DDAVP treatments as needed and regular antifibrinolytics. Because Tommy has a mild form of hemophilia, his treatment does not need to be as complex as others with more severe cases. Using DDAVP infusions whenever profuse bleeding occurs will help to manage it in a first aid manner. However, taking the antifibrinolytics will hopefully take care of any profuse bleeding before it happens by maintaining clots in order to avoid any emergencies. With this knowledge, Tommy and his family are able to move on and treat his disease accordingly. Tommy's parents can now rest easily, knowing that they know how to safely treat and protect their son with the knowledge of what his disease is and the treatment regarding it.